Welcome to Muscle Research Review for the week of February the 23rd, 2015. Quick research summaries for the very busy health and fitness professional. So let's get started. Do you use the prone hip extension test with knee flexion? It's often used because studies have shown that there is a delay in glute max activation in those with chronic low back pain. Using a prone hip extension test with knee flexion can reduce the delayed firing of the glute max. However, a new study looked at two more variations of this test to see if they were any better. The study compared the prone hip extension with knee flexion test in neutral to one with hip abduction and one with hip abduction and external hip rotation. Here's what they found. There is a difference between all three tests in terms of earlier firing of the gluteus maximus. From the best results to the worst, it followed this order: hip abduction and external rotation, hip abduction, and then hip in the neutral position. The hip abduction and external rotation group also showed earlier activation of the bilateral multifidus and left lumbar erector spinae. Putting into practice, this should give you another variation to look at for the prone hip extension exercise with knee flexion. However, a few things to note. The study was cross-sectional in nature, it involved healthy men only, and the speed of the movements was not controlled. I'd love to see future studies that looked at whether there was actual low back pain reduction with the differences between these exercises. The bridging exercise has been shown to improve strength of the glutes and the hamstrings and improve lumbar stabilization in patients with low back pain. However, deep muscle co-contraction needs to occur first to prevent excessive lumbar lordosis. Using the abdominal drawing in maneuver can pretty much help prevent this. There's been several studies on building deep muscles while performing the abdominal drawing in maneuver and bridging exercise. The question is there any difference between performing both on an unstable surface? That's where this next study comes in. The study assigned 15 students to the stable bridging and 15 to the unstable bridging group. The unstable group is provided with a balance pad under the feet to increase the degree of exercise intensity and instability. Here's what they found. In the stable bridging group, only the transversus abdominis muscle was altered, while both the transversus abdominis and the internal abdominal obliques showed significant changes in the unstable bridging group. In summary, for bridging exercises, abdominal drawing in maneuver and unstable surfaces placed under the lower extremities are usually recommended to improve muscle contraction. Which kind of takes us into our next study that looked at the plank exercise. For this study, plank exercises were performed on a stable mat on a dynamic cushion pad placed under the upper extremities and a pad placed over the lower extremities. They again used ultrasound imaging to assess activation of the transversus abdominis and the internal oblique muscles. Here's what they found. Pad over the lower extremities showed an increase in the thickness of the transversus abdominis and the internal abdominal obliques. Changes in transversus abdominis was more significant for the lower extremity pads over the upper extremity pads. Want to develop a more effective plank exercise? Apply an unstable condition to the lower limbs. Do you use the prone horizontal abduction exercise for scapular muscle activation training, especially for activating the middle and lower trapezius? Well, previous studies have shown positive results. Mosley found high activity of the middle and lower trapezius at 90 degrees. Kinney found the muscles to be more activated at 90 and 125 degrees rather than at 160 degrees. However, this new study took it one step further by assessing whether there was differences with shoulder rotation angles of internal rotation, neutral, and external rotation. Here's what they found. Shoulder rotation angles did not produce any differences in upper and middle trapezius activity. However, only the lower trapezius activity was changed with the rotation angle conditions. Specifically, lower trapezius activity was highest in internal rotation at about 120 degrees, but also lowest during the neutral position. However, this position wasn't recommended since it was a secondary reaction, elicited by activity of the upper traps. So, what angle was recommended? They found that 120 degrees of abduction with external rotation of the shoulder was most effective. In the early stages of rehabilitation, external rotation at lower angles of 30 and 60 degrees was recommended to limit the activity of the upper trapezius and raise the activity of the lower trapezius. Do you see patients or clients post-ACL reconstruction? This new study asked the question, what's the effect on hip flexion strength at 1 year follow-up to ACL surgery? The study looked at 68 males with ACL surgery. 36 had a hamstring tendon graft, and 32 had a patellar tendon graft. They compared these to 64 healthy males. Results were as follows. Hip flexion strength decreased significantly in the ACL group compared to the control. However, those with patellar tendon grafts had stronger hip flexors than those with hamstring grafts. Now, putting it into practice, if the athlete needs to preserve strong hip flexors, patellar tendon graft may be recommended to preserve stronger hip flexors. Now, addressing hip flexors through the rehabilitation stages is also something you need to be aware of. If you got any comments, please leave them below, and make sure you subscribe to our YouTube channel for any future updates, because we'll be doing this on a weekly basis to give you some updates on your muscle research review. Thanks, guys.